as the middle and primary school is going to be suspended temporarily, we have also going to continue the personal protections for the medical workers, for the delivery men, and also the social security workers. We are going to guarantee their good day-to-day life conditions, and we are also going to receive any complaints if it is related to the pandemic. For the lockdown areas and the temporary lockdown areas, we are going to let the community play its rules, and all the community is going to be worked until the last 100 meters. We are also going to further optimize the process and satisfy the day-to-day prevention and control for the citizens, for the key industries, key sectors, and also the key people. We are going to continue the special protection. Today we have with us Deputy Director of the CDC Beijing Municipality, Li Yang, Mr. Peng Xuehai, the Deputy Director of the Beijing Information Bureau, Deputy Mayor of Chaoyang District, Madam Yang Beibei, and Mr. Zhang Mingzhi, the spokesperson of Chaoyang District. And Madam Pang Xinhuo, the Deputy Director of the CDC. So first we're going to give the floor to Madam Pang Xinhuo to bring us the latest update of the COVID-19 spreads in Beijing. And friends from media, good afternoon. I'm going to bring you the newly added cases in Beijing, as well as a tape of our day-to-day life. By the end of the 16th of May, the newly added COVID-19 cases in our city is 16 cases, and starting from the news press of May the 5th, that is to say from the 15 p.m. yesterday to the 15 p.m. yesterday, the newly added confirmed cases is 66 cases. That is to say number 670 to number 178. That is to say 21 cases in Chaoyang District, 21st cases in Fengtai District, and two other cases for Haidian, Chaoyang, and Fengcheng, one case for Dongcheng, one case for ordinary cases, and 48 for mild cases. There is 60 of them from the lockdown areas, and 2 of them is from the social scanning. We have made sure that all the areas has been controlled. So I'd like to report to you the latest updates. The number 668 is being detected through the community level detections. He is living in the Donghuashi district of Dongcheng. On the 28th, 27th, and 28th of April, the 1st and the 3rd of May, he is reported to be a negative case. He has reported that on the 3rd of May, he has suffered from the sore throat. On the 4th of May, he participated in the community level nucleic acid test, and he was diagnosed officially, and he belongs to the mild category. The infection is still under direct epidemiological cases is still under tracing. Number 666 is currently living in the Yuquan Street of Fengtai District. Jingtian Mingtian Hotel, he is not vaccinated. On the 4th of May, he is a part of the community level screening, and on the 5th of May, he is diagnosed as a confirmed cases belonging to the mild category. Before we have reported, he has been to the Mentogo district and the Meiyun district. He has certain case of spreading the disease to the social to all the sectors of society. On the 4th of May, currently we have reported 610 cases. It is around 15 different districts, among which 251 in Chaoyang District, 155 in Fangshan District, 61 in Tongzhou District, and 41 in Fengtai District, 28 in Haidian District, 22 in Shunyi District, 12 in Changping District, 11 in Daxing District, 6 in Dongcheng District, and for Xicheng and Miyun and Yanqing, there are 2 cases separately. There's 1 case for the Mentogo District. The newly reported cases is coming from 3 gatherers. The first one is that in the Chaoyang District, there is a restaurant in the Guomao area, which is called the Xiangcai area. And currently, we have seen accumulated 18 different cases. And in the second restaurant, which is called, there is another gathered, which is in the vegetable market in Chaoyang District. There is newly added 10 cases. The third gather events is in the Daizhi Caomu village. The newly added cases is 7 cases. Currently, it has accumulated 15 cases. The newly added cases is all coming from the lockdown area. The related infected cases share the same dormitories. Since it is densely populated dormitories, it is easy to spread the disease. So here we remind all the citizens in Beijing that even if you are living in one apartment, you should still wear a medical mask to prevent the spread of the virus. Currently, we are still seeing the COVID-19 cases in our city remaining on a high level. It is complicated, and we should stick to the principles of zero COVID policy. Using the epidemiological research as well as the NAT test to figure out all the potential sources of the COVID-19. With all the measures that we have undertaken for the lockdown, as well as quarantine, we want to thank all the citizens for your participation. Please follow all the policies and stay indoors and live independently, and do not share the meals with the people who is living in the same apartment, especially family members. And please sterilize the kitchens as well as the toilet in your apartment. If there is any occurrence of the fever, dry cough, diarrhea, fatigue, lack of disease, and short of breath, please report to the community. Currently, facing this rampaging COVID-19, let's join our hands to win the battle of COVID-19. This is going to help us to forge a strong Great Wall for Beijing. So here is my report. So I'm going to bring you the latest information for the high risk, medium risk, and lower risk areas in Beijing. By the 5th of May, Jinsong District, Nongguangli community has reported 7 cases. And according to the evaluations of the CDC Beijing, and according to the risk arrangement in Beijing, so far, the Nongguangli community in the Jinsong District of Chaoyang District is going to be rising from the medium risk region to high risk region. Currently, there are 18 high risk region, 30 medium risk region. Thank you. So now we are going to give the floor to Deputy Mayor Yang Beibei to give you a brief introduction toward the situation in Chaoyang. Dear friends from media, I'd like to brief you the COVID-19 prevention and control situations in Chaoyang. By the end of the May the 5th, there is a newly added 31 cases in Chaoyang District. All of them belongs to the lockdown region. On the newly added areas of high risk, including the Qicai and Kang Pharmacy. On the 27th of April, the community of Nongguangdongli, the 7-Eleven convenience store of the 28th of April near the Jianwai district. And also the Laiguxiang supermarket in the Wangjing district. Chang'in Park on the 28th of April. On the 1st of May, from 10 a.m. to 11 a.m., Zhang Yiyuan Tea Shop. From the 11 a.m. to 12 a.m., the Gongyuan Seafood Market. From 19 p.m. to 19:30, Yujing Shopping Market, Guoduomei Fruit Store. And also the Yigou Youping Supermarket. On the 2nd of May, from 9 a.m. to 10 a.m., Jingjie Seafood. From 11 to 12 a.m., the north gate of Jingjie Wuxiang Street. On the 3rd of May, from 11 a.m. to 12 a.m., Zhujiang Dijing Chenguang Supermarket. So if you have any overlappings of the tracks with the above-mentioned restaurant and supermarkets and seafood stores, please report to the community and also report to your company, or please dial the hotline of Chaoyang CDC 887-988. The second information I'd like to bring you is that we are going to speed up our actions to cut off the spread of COVID-19. So for the newly discovered cases, a rapid epidemiological research is going to help us discover all the potential risk points. At the same time, we are also going to focus on the key areas for the Panjiayuan Shuangjing Jingcong 18里店 Xiaohongmen Street, which belongs to the temporary lockdown areas, Jianwai lockdown area. We are also going to do several rounds of the PCR test to make sure that all the rounds is going to be prevented. All the potential COVID-19 cases is going to be discovered. According to the latest epidemiological research result, after all-round evaluations, there is a newly added lockdown areas for the Xiaohongli district. And number 1 building in Guanghuali building, number 3 and number 5 building, and the Jianwai district, Jingmao building, as well as the Guanghua South, Guanghua Nanli community. They have recategorized as the lockdown areas. These people living in this area should stay indoors, and we are going to deliver the food and other daily necessities at the front door. For the 2 different houses alongside the north of the Jianwai district, we are going to make them the lockdown areas. So here we want to remind you once again that please do not come on site, and please make the community quiet, and we are going to see the restorations of our daily life. Coming into the next stage, we are going to give you the latest information about the potential risk and release the information. Second, we are going to adopt the stricter requirement for the requirement that if it is not necessary, do not go to any unnecessary places. For the potential governmental institutions, private and public companies, please start the working at home and reduce the potential flow of the people. We have came up with a strict requirement. All the governmental institutions and SOEs, as well as the private company, can stay in their own home. For the commercial workers, in principle, they should stay at home. For the frontline workers, for the medical workers and the volunteers, they can come to the communities. And there is a closed-loop management in the Chaoyang district. all the service industries in the district is going to suspend it. The KTV, internet bar, the beauty salons, cinemas, laboratories, among other different indoor entertainment shops, as well as other different training institutions should suspend their operation for the infrastructures or moving the furnitures. Among other different industries should also be suspended. We have also forbidden the dine-in, and also for the commercial supermarkets, it's going to be suspend its operation. For the other different platforms, we are going to increase the services, including the delivery services and also the taxi services. For all the other different workers in the private sectors, we are going to make sure that we are going to do several rounds of the PCR test. We have also required that for each one of the building, there should be one person who is responsible. And we are also trying to motivate the potential grassroots workers. And for 1,100 head of the building, they have spread the information. And for the 43 different districts and streets, a lot of the business compounds has been suspended their operations. Inside of these districts, the SOEs and also government institutions are calling for staying at home and working from home. We have understood that this is demonstrating their support for the Chaoyang district. We have also organized a campaign to give further guidance to the industries. And for those who is not following the requirement of the policies, we are going to punish them all according to the law. By the end of yesterday afternoon, there is only 5% of the people is working and arriving in the workplace. At the same time, we also require to reduce the workflows in these buildings. We canceled all the dine-ins in the business buildings. I know that in the recent days, there is a dramatic change in your life and work. You are not only enjoying any travels and not any delicious dinners from the fancy restaurants, but we can see that the personnel, the companies, and all the social entities is shouldering you responsibilities. You are choosing to you are choosing this lifestyle of quietly. And we are trying to make sure that all the health of the people should be maintained. We believe that if we stick to the principles, we are going to win the battle against COVID-19. Under the long-term stickness, we are going to see a rapid recovery of our daily life. Thirdly, we need to optimize the procedures for the screenings. By the 5th of May, the regional PCR test of Chaoyang district is reaching 4.2 million units. And we have screened one tube which is tested to be positive, and we have done further screening for that tube. After several rounds of the PCR test, there are sporadic potential COVID-19 cases. That is to say, we have not fully cut down the spread of COVID-19 in the Chaoyang district. On the 7th, 8th, and 9th of May, we are going to continue the regional PCR test. And fourthly, we are also going to make sure that our services is very detailed and thoughtful. We are going to continue to make sure that the prices in the Chaoyang district, prices of commodities in the Chaoyang district remain stable. On the 8th of May, the total storage of the daily necessities in Chaoyang district remains at 2,558 tons. We are also working with companies across the city. We have increased the piles stored in the warehouse. At the same time, we are working together with the e-commerce platforms of the Hema Maicai and also Dingdong Maicai. We have also recruited more delivery men to make sure that there is going to be sufficient manpower satisfying the delivery demand. We have also made sure that all the medical demands and also the medicine demand is going to be met yesterday in the Shangjing district and Jinsong district. There is 27.8 tons of the vegetables and foods, and there is orders for around 80,000 where people ordered on the e-commerce platforms. For the temporary lockdown area, according to the different features, we have came up with 166 checkpoints. We have also listed 1,049 people belongs to the categories of the vulnerable groups, which is elderly people, pregnant people, and also the young kids. For the platforms, including the Jingdong, Maicai, and Meirui Youxian, they have increased the vegetable storage online. We have also dispatched 70 vehicles to meet up the potential medical demand for the elderly people. For the CPC community, for the CPC party members, they become the volunteers in the community level. Currently, there is around 27,888 Communist Party members automatically becomes the volunteers of the supporting the key streets and key areas. There's around 4,000 people working at the front line of the COVID-19 prevention. The delivery men and also our social volunteers is also becoming part of the delivery men, and I believe their wholehearted work is going to help us to build a great war against COVID-19 for the Chaoyang district. Here, I want to thank the volunteers again for their contributions. In the recent few days, there is a story in the Chaoyang district, that is to say, one medical worker who is working at the PCR test area suffered from the choking of the breast. And during the process, when we were trying to carry her on the ambulance, and the medical worker is really worried that she is going to postpone the whole process, and she asked that she was seeing that she is wasting the medical resources. And at this critical point, we are going to adopt the critical strategies. Let's sum up our effort with the notes of General Secretary Xi Jinping's mention. That is to say, the time and tide waits for no man. Only using the real and practical actions, we are going to stick and power through these difficult times, and we are going to spread the spirit that we are willing to win the battle against COVID-19. And this important time, we are going to be joining our hands together, and I think the Chaoyang district is going to finally see a zero-COVID situation. Now we are going to give the floor to the Deputy Mayor of Fangshan District to introduce us the situation in Fangshan. Friends from the media, I'd like to bring you the COVID-19 prevention and control in Fangshan District. So far, there is newly added 20 cases of Fangshan, among which 5 of them belongs to the medical monitoring areas, 14 of them belongs to the medium lockdown areas, and 5 of them belongs to the lockdown areas. So let me report to you the newly added risk area in the Fangshan district, the Dazicao village of Yancong town. On the 28th of April, the Dazicao village, around 30 p.m., the Huangguan supermarket in the Dazicao village. On the 27th of April, number 18 bus from the Beijing Technology Institution to the subway, and also we are seeing a vegetable supermarket near Qianxi Jiayuan residential area. On the 28th of April, from 8:30 to 14 from 8:30 a.m. to 14:30 p.m. 大子草悟 Village. The Huaguan supermarket in the 大子草悟 Village. For the 30th of April, Yonghexin Noodle Restaurant in the 盐子草悟 Village. From 8 a.m. to 9 a.m., the Beijing Tongji Dongfang Hospital. From the 15th p.m. to the 16 p.m., the Yonghexin Restaurant in the 大子草悟 Village. On the 1st of May, from 11 a.m., the Zhangzhongcun Park. On the 2nd of May, from 7 a.m. to 17 p.m., Fengshan District Auto Spare Parts Co-Limited. From the 18 p.m. to 19 p.m., Beijing Tongji Zhongfang Hospital. From the 30 p.m. to around 14 p.m., the Beijing Tongji Dongfang Hospital. The Deyifeng supermarket in the 大子草悟 Village on the 3rd of May, 4th of May, and 5th of May. The Zhangzhongcun Park of Yancun Village. We are still continuing our epidemiological research. Here I remind all the citizens, please focus on the latest risk measures, and if there is any overlapping between the previous tracks, please report to your company and also to your community. Second, I'd like to talk about our measures that we've taken for the prevention and control. The newly added risk points. For the potential risk areas, we have a quick lockdown, and we are trying to make sure if there is any close contact and secondary close contact. At the same time, we are trying to exclude any potential areas, including the warehouses and also the overlapping areas between the city and village. Second, we are going to continue the PCR test across the city. After the May Day holiday, the 328 restaurants in our district is going to be closed, and all the entertainment institution is going to continue to close, and the Bureau of Commerce is going to continue the inspections for the operations for the above-mentioned institutions. For the companies, all the staff should work from home, and the ratio to go to the workplace is going to be cut down to its minimum. We encourage those who are staying at home to become the volunteers of the community. Thirdly, we are going to continue the PCR test. On the 5th of May, we have conducted the 7th rounds of the PCR test. Today, for the potential positive street, we are doing a regional PCR test. So here I kindly ask all of you to do the PCR test for the pregnant women. And also for the elderly people, we are going to arrange the PCR test at their front door. There is no sightseer during this battle of COVID-19. The city of Beijing has faced unprecedented situations. We here kindly remind all the citizens in the district, please stay indoors and reduce the inflow of the residents. The battle against COVID-19 needs all of us to counter up our efforts. We firmly believe that with the support of our citizens and your selfish contributions, we are definitely going to win this battle of COVID-19. Thank you. Now we are going to give the floor to Deputy Director and also of CDC, as well as head of the screening of the PCR test, Mr. Liang, to bring you the latest update of the informations. Dear friends from the media, we have conducted 3 rounds of the nuclear acid test across the city. Yesterday, we have screened 22 million people, and there is 5 tubes which is going to be reported positive. 1 tube in Chaoyang district, 2 tubes for Chaoyang and Shunyi district respectively. All the other prevention and control measures continued according to the arrangement of the municipal government, as well as the latest trend. We have decided on the 7th, 8th, and 9th of May, we are going to organize the district of Chaoyang, Fengtai, and Fangshan. We are going to conduct 2 rounds of the nucleic acid test. Starting from the 25th of May, we have conducted several rounds of the nucleic acid test, and this helps us to cut down the tracks of COVID-19. Our citizens actively participated in the nucleic NAT test, and this is actually helping us to draw the better picture toward the spreading of COVID-19. Here again, we want to thank all of our citizens and our frontline medical workers. We also want to remind all the citizens that according to the arrangement of the different communities and according to the arrangement of the specific building, please do a good job in the PPE protection. And during the PCR test, please keep a social distance of 2 meters. And this is also going to help us to avoid any overlapping of the disease. So here we are going to give the floor to the Deputy Director of the Beijing Economic Development Zones, Mr. Peng Xuehai, to give us a brief introduction toward the alert in the Beijing Health application. Friends from the media, dear citizens, under your full support, we have conducted several rounds of the PCR test. During the process, we have noticed that some of the citizens, because of all kinds of reasons, they did not finish the PCR test, and there are some of the alert happened in their Beijing Health Code. I'd like to explain this alert. According to the requirement, the government institutions came up with the alert requirement. The Beijing Health Code is going to remind every citizen. Currently, there are 5 different categories of the alert. The first is about the number 1 category of the alert is alerting people who has been to the potential risk who has been to the potential high-risk area. Please suspend to come to Beijing. And if this area reports no case in the past 14 days, or the citizens can apply for the green QR code once again. If you have already arrived in Beijing, please report to the hotels, to the communities, and also to the companies, and please fulfill your duties. If you do not report to the communities, the alert is not going to be disappear. And if you go to the PCR test by yourself, this is not going to satisfy. The alert is not going to disappear. The second category of the alert is indicating that the person is currently coming from abroad to Beijing, and he or she has a requirement to fulfill a 40-day quarantine in Beijing, and this alert is automatically going to disappear after 40 days quarantine. And the third category of the alert is about some of the potential overlapping tracks in the city of Beijing. So if you are still in Beijing, please report to the local community government. And if there is no related risk, we can dissolve the potential risk, and also the self-conducted PCR test is not going to help the alert. It's not going to solve the alert. So if you are not in Beijing, please suspend your trip or travel to Beijing. And if there is no previous historic records of COVID-19 infected counties and cities, you can apply for the green code once again after 40 days. The fourth category of the alert is the people who did not finish the nucleic acid test in the required times. According to the policies, you should finish the PCR test according to the requirement. First, if you enter into Beijing 70 hours, and if you have bought the 4 different categories of the medicines. Thirdly, if there is any fever or fatigue, or you get treated in some of the grassroots level clinics. The fourth alert is if there is any requirement in your professions. The alert means that the Beijing Health Code did not get an official report of in the required times. Please finish the PCR test in the required times, and if the PCR result comes out, the alert is going to be disappeared. And if the result is not coming out, please contact the potential PCR testing laboratories. The fifth category of the alert is echoing with the potential category that for those who have been traveled to the high-risk region in China, please apply for the QR code after 40 days of local quarantine. And if you have already arrived in Beijing, please report to the community and relevant governmental institutions. And if you do not report to the community, the alert is not going to disappear. After 14 days quarantine, and with no historic track of this potential above-mentioned area, this is going to, especially for the fourth category of the alert, please fulfill the duty of PCR test according to the government requirement. One thing I need to explain is that because the testing data is coming from different laboratories, from the sampling to the result, there is a huge gap. There is also different accuracy levels between the different systems. We used to deal with the alert at the midnight, but after the 4th of May, the Beijing Health Code has upgraded one version that is going to be helping us better treat the potential alert. Starting from today, we are going to adopt the optimizing system for the fourth category of the alert. This is also going to help us to better help the citizens and reduce the inconvenience that we created. For all kinds of different categories, we should also test about the PCR test result within the 48 hours. I need to clarify once again that if the PCR test result is within 0 days, 1 day, and 2 days, that is also means the PCR testing result is workable within 48 hours. So here we encourage all the citizens to continue the PCR test, and we are also going to optimize our effort to provide the citizens better service in Beijing. Thank you very much. So we are going to wrap up today's news release. Thank you.